of the pillars of a flourishing society is a strong healthcare system. And in rural communities like Marietta, Ohio, the demand is even greater. Yet despite remarkable advances in medicine, these regions continue to face significant barriers that limit access, strain resources, and put essential services at risk.
Small towns are challenging for lots of reasons. Our issue is that over the last 50 years, we've seen a lot of employers begin to shift and consolidate and sell. And so 50 years ago, we looked much different than we do today. And that's the pressure on the health system. And even though we continue to grow and technologies evolves and allows rural hospitals to do much more than we ever would have thought possible 50 years ago, the cost of that has continued to rise.
Memorial Health System is not on an even playing field with some of our large urban hospitals. When you look at where the medical schools are located, by the time you're board certified and ready to come practice, you may have been in that area 6, 7, 8 years. Now the idea of recruiting you, now it isn't just simply taking a job. It's I've got to sell my house, my spouse has to find another job, maybe my children have to move schools. So the cost of recruiting specialists and physicians at Memorial is much greater than our large urban counterparts.
We are proud to serve all the patients in our community, whether you're covered as a senior by Medicare or if you have economic challenges and you're covered by the state's Medicaid system. They do reimburse the hospital much differently than our commercially insured. But what we actually get paid is often just pennies on the dollar. And one of the fallacies, I believe, in the way we've structured healthcare in America is that it's often more expensive to field a team of healthcare professionals to get doctors who could work anywhere in the world to come to small towns and serve those patients. We often have to pay a premium.
Attracting top talent can be very difficult in this market. I often talk to providers and physicians from around the state. If I were to blindfold them and bring them here to my town and put them inside of my facilities, they would never want to leave. But geography is a tough thing. We're located approximately 90 minutes to 2 hours away from the largest metropolitan areas. So we have to work hard at strategies when it comes to recruitment. But again, that costs a lot of money to do that, to get top talent to these areas so we can keep the care local in our communities the way that our community expects us to do.
Over the years as a board member, one of my first focuses when I joined Memorial was making sure we kept healthcare local. And people would say, well, but you could join this system in Columbus or this one in Cleveland. But also people find out in those communities that all of a sudden healthcare leaves, because the bigger system wants you to send patients there. All of a sudden, if you cut the number of physicians by 20, 25, 30%, you've lost that effect in your community as well as the availability of healthcare quickly.
Having a full-service hospital in your community is an absolute must from a workforce development point of view. If you think about just a relatively routine surgery, you're looking at a minimum of 4 trips where you're going to see that surgeon. If you've got to drive to Columbus or if you've got to drive to Cleveland, now that's a 2 to 2.5 hour drive. That's 3 full work days that are lost for someone here. And if you're working, if you don't have health insurance, if you don't have sick call, if you're a new probationary employee, all of a sudden the idea of going up and getting this care becomes secondary.
In Ohio, we have 12 million people. But there's a large majority of that population that is located in rural areas of the state. And so when we look at how to serve those communities, we must look a little deep into our souls to say, where do we need to meet our customers?
Amid the challenges facing rural healthcare, Memorial Health System stands as a model of resilience and innovation. By expanding access, forging strong partnerships, and investing in technology, they are ensuring that care remains local, sustainable, and responsive to community needs.
There's many things that we do to create opportunities for our patients as well as our providers. One of the things that we do that's specific to Memorial Health System is that we provide same day and next day access for our primary care, which means our patients can be seen that same day or the next day that they need to be seen by their physician. We also provide free virtual urgent care. Another thing that we do is that I talk a little bit about making sure that our providers have the tools that they need to provide the highest quality of care for all of our patients. And so one of my roles as the Chief Medical Officer is to ensure that they in fact have the right tools. So we partnered with the Mayo Clinic. Why Mayo Clinic? Well, it's the #1 most regarded name globally for quality in healthcare. Now we have all the tools that they have and we can make them available at no cost to our patients here in this community each and every day.
Innovation is in the core of healthcare, and certainly for rural community hospitals, we're used to making things work very quickly, learning from others. So we get to see what emerges and then pick and choose the pieces that are really going to have a positive impact and make sure those are the things we implement here.
I can't believe how many stories I've had of people come in and say, oh, I just found out my husband has cancer, and I'm so excited that he can get help here. I've got children. I can't run back and forth every day. I don't want him in Columbus for a week or a month by himself. But I think that's community. I think that's what healthcare is about.
With over 4,000 employees, Memorial Health System is the largest employer in our community by a factor of 4. All of those kind of entry-level jobs, we turn to the hospital system to help people work their way out of poverty. Without that tax base, Marietta City ceases to function. That's how important the health system is to this community. We will not make it if we lose our health system.
Memorial Health System, strengthening healthcare today to secure a healthier tomorrow. To learn more, visit our website, mhsystem.org.